Welcome to the Office of Human Resources Health, Dental, and Vision Benefits tutorial. Throughout DCA, the Office of Human Resources is also referred to as OHR. Benefits are paid 1 month in advance and are effective the first day of the month following OHR's receipt of enrollment forms. For example, benefit forms received on July 5th would be effective August 1st, and the pay warrant received on July 30th for the July pay period would pay for August benefits. Employees are eligible for benefits if they have an appointment with more than 6 months, which is at least 6 months plus 1 day and a time base of half time or more. Hourly employees should reference the Hourly Employee Handbook and the applicable bargaining unit contract to determine when and if they are eligible for benefits. The Hourly Employee Handbook is located on Inside DCA. Inside DCA is the Department of Consumer Affairs intranet available to all employees, and the web address is inside.dca.ca.gov. This handbook is available under the Human Resources tab. Newly eligible employees must submit health, dental, and/or Premier Vision benefit forms to OHR within 60 days of eligibility. After the initial eligibility period, changes can only be made to benefits when there is a qualifying event or during open enrollment. When a qualifying event occurs, such as a divorce or adoption, employees have 60 days to submit benefit forms to OHR. Benefits are effective the first day of the month following the receipt of the benefit forms. In some cases, the type of qualifying event will change the effective date. Contact your assigned personnel specialist in OHR to determine if a situation is a qualifying event. Health, dental, and vision open enrollment is customarily the second week in September through the first week in October. OHR notifies employees of the open enrollment dates each year. Changes made during open enrollment are effective January 1st of the following year. This is your opportunity to make any changes to benefits without a qualifying event. Employees in bargaining units 1, 4, 9, 10, 11, 12, 14, and 21 receive a state contribution. The state contribution is deducted from the total cost of the benefits selected, and the difference is the employee's out-of-pocket cost. Employees who receive a state contribution will only see their out-of-pocket expense listed on their pay warrant. Let's look at an example. For this example, this employee is in bargaining unit 1 and has their family enrolled in medical benefits. Let's assume the state contribution amount for the current year with a family size of 3 or more is $1,500, and the amount of the medical plan selected is $1,800 per month. The employee will only see the difference of $300 for their medical coverage as a deduction on their pay warrant each month. Excluded employees and those in bargaining units 2, 7, 16, and 19 receive a consolidated benefit allowance known as a co-ben allowance instead of a state contribution amount. This allowance is applied towards the cost of all benefits selected, including dental, medical, and vision. The co-ben allowance is added to the pay warrant and will appear as a negative number. In accounting terms, the negative symbol means that the amount is being added to the warrant. The cost of the selected benefits are deducted from it, and any remaining co-ben allowance is additional taxable income for the employee. If the selected benefits cost more than the co-ben allowance, which is usually the case, that is what the out-of-pocket expense is. Let's look at an example of how you will see it listed on a pay warrant. This is an example of the deduction side of a pay warrant. In this example, the co-ben allowance is $1,658, and it has a negative sign next to it. The medical cost is $1,831.93, the dental cost is $135.88, and the vision cost is $8.64. If you add the medical, dental, and vision together, it totals $1,976.45. If we subtract the co-ben allowance of $1,658, this employee's actual out-of-pocket expense is $318.45. To view co-bin and state contribution rates, visit the California Department of Human Resources website at calhr.ca.gov. These rates usually change each year. Health benefits are administered by the California Public Employees Retirement System, referred to as CalPERS. The cost for health benefits and plan information can be found on the CalPERS website. When enrollment forms are received from employees, OHR enters the employee's health benefit selection directly into the CalPERS system. Dental benefits are administered by the California Department of Human Resources, known as CalHR. The cost for dental benefits and plan information can be found on the CalHR website. Newly hired employees in bargaining units 1, 4, 9, 10, 11, 12, 14, and 21 may only select a prepaid dental plan until they have 24 months of state service. At the end of the 24-month period, employees have 60 days to elect or change to a plan with higher coverage. OHR routes the dental benefit form to the State Controller's Office. On average, it takes the State Controller's Office 2 to 3 months to process them. Due to the length of processing times, an account receivable may be established for employees to pay back their portion of the dental benefits. Employees will be notified if an accounts receivable is established. If you or a dependent must see a dentist before the dental benefits have been processed, contact your assigned personnel specialist in OHR. The personnel specialist will have you or the dependent manually add it to the applicable dental insurance. You will know if your enrollment forms have been processed by reviewing your pay warrant. If the deduction for dental benefits is not showing on the pay warrant, the enrollment has not been processed. At the end of each month, manually added employees and/or dependents will fall off until the State Controller's Office processes the enrollment form. So if there is an additional need to see a dental provider prior to the enrollment being processed, contact the personnel specialist to have you or your dependent add it back on manually. Vision benefits are also administered by CalHR, and plan information and rates are available on the CalHR website. Vision Service Plan, known as VSP, is the only service provider. There are 2 plans available, Basic and Premier. Basic vision benefits are provided to all employees and their dependents, and an enrollment form is not required. Employees who do not receive a co-bin allowance do not pay for basic vision coverage. However, permanent intermittent employees are required to submit a basic vision enrollment form upon eligibility. Refer to the Hourly Employee Handbook for more information regarding permanent intermittent employees and when they become eligible. The Hourly Employee Handbook can be found on Inside DCA under the Human Resources tab. Premier Vision benefits are available at an additional cost, and an enrollment form must be completed. To assist with determining out-of-pocket benefit costs, there is a benefits calculator on the CalHR website. For questions regarding any of the benefits in this tutorial, call area code 916-574-8300 and ask to be directed to your assigned personnel specialist.